Welcome back for this second part of Weekend Prime, where we discuss health matters. And in this second part, we'll be taking a closer look at the surgeries done for repairs after the cut, for repairs following obstetric injuries or during birth, and any other injuries that will happen to women, to the women's anatomy. And before we start this discussion, we'll listen in to Dr. Mercy Bowers, who's a gynecologist who does repairs and specifically clitoroplasty, and what she had to say when she was in Nairobi to carry out a surgical camp at Mama Lucy Hospital and at Karen Hospital. Let's take a listen and then we'll start that discussion from that point.
The restorative procedure allows the clitoris to regain its function as a sensory sexual organ. This surgery is not the end of FGM, but for the women that have already been victimized by cutting, this offers hope that they can gain some of their life back. We found that the patients citing their #1 reason for having the surgery was not sexual feeling even though that is an important part of it, but to regain what they feel has been stolen. They feel their identity was taken with cutting, and they are getting their lives back.
So that was Dr. Mercy Bowers, who's a gynecologist who does clitoroplasty. And joining me for this discussion is our very own cosmetic gynecologist, Dr. Francis Were, who will take us through some of these procedures. And one of the big questions that has come from you and from many of you about clitoroplasty is that after FGM, they presume everything has been excised off. Then what is there to reconstruct? And Daktari, I'll start you from that point. People are asking, what is there to reconstruct after FGM when presumably everything has been actually mutilated?
Thank you very much, Dr. Mercy, for inviting me for this, this very interesting and very controversial talk. Now, after FGM, depending on the degree of the cut that has been done, and of course the people performing the cut may not be experts in anatomy. Some actually are excessively done, so much so that the whole of the external genitalia is completely cut off. And therefore you may find that there may be little, if any, reconstruction that can be done. However, some of them are a little bit modest, and you find that they only shave off a piece of the clitoris, for instance. And therefore, this is where now reconstructive surgery comes in. A procedure called clitoroplasty, that is trying to reconstruct the clitoris, because the clitoris basically is it's actually like the male genitalia, the male organ, but the shape of it is slightly different in the female. And during clitoroplasty, we try and bring out that bit that is hidden deep in the tissues to come out a little, maintaining the nerve supply and the blood supply so that the woman can still have her sensation during coitus. Plus,
do they actually regain this sensation as the doctors promised the women that they would?
Yes, they do. Because during FGM or during the cut, some people just cut the covering of the clitoris, that is the hood, and therefore during healing, there is scarring over the clitoris. So what we do during reconstruction, we simply remove the scar to expose the remaining bit of the clitoris that is hidden deep in the tissues. And therefore, this helps the woman to regain her sensitivity during coitus.
Okay. Yes. And is that the only reconstruction that can be done for the woman after undergoing FGM?
Well, that's not the only thing that we can do for the woman. We can also try and do a bit of reshaping of the labia. For instance, if the labia is not too badly cut off, with the help of plastic surgeons sometimes, we're able to mobilize skin and try and cover the external genitalia in a way that tries to make it look more or less like what it was before, although it never quite is the same. But it depends on the degree of the cut. Yes.
Okay, and apart from FGM, there are other instances that women suffer injuries to their external genitalia. Which are these instances, and what remedy is there for the women?
Okay, during childbirth, for instance, depending on one, the size of the baby, and of course the size of the woman herself, sometimes the external genitalia does undergo some injury, and especially the perineum. Now, when that happens, or during childbirth, the pelvic floor muscles tend to be stretched beyond their stretchable limits, and therefore that results in tears that eventually, when they heal, even if done properly by a qualified medical practitioner, sometimes they are left with defects. In other words, the external genitalia or the vaginal opening may appear slightly wider than what it was before childbirth. And this, in most instances, the women are the ones who come and complain about that they feel that things have changed. The men rarely complain for fear of offending their women, but there are few men, depending on the relationship, who actually encourage their women to come to hospital and be assisted. So what do we do as cosmetic gynecologists? We try and reapproximate the tissues or restore the anatomy to almost the level it was before. Sometimes we get away with it. We're able to do it to near perfection, if not better than what they had previously. And for those women who've had that kind of repair, usually the relationship is sparked up and people are very happy. And life is good thereafter. Other procedures that sometimes we do, for instance, women may complain of excessively long labia minora genetically. Some who are born with very long labia, and some who culturally undergo pulling of the labia, like our neighbors in Uganda, for instance, and Mozambique. To them, culturally, the longer the labia, the better for the woman. But of course, in the Western world, that is a little bit different, because you find, for instance, in Japan, they adore large labia minora. In the Western world, like in Europe and in America, the smaller the labia, the better for them. So those who have large labia in the Western world usually go to their doctors and have reduction or labioplasty. And that, again, we're able to do. The good thing about that is that that's a procedure that can be done without anesthesia. And usually it can even be done in an office setting with good equipment. And the results are usually very remarkable. But then again, this brings in the issue of cosmetic gynecology. Cosmetic gynecology is a very wide topic. And it involves a lot of issues, because you do not perform cosmetic gynecology on any woman who walks into your office. You have to take a good history and find out if really what they're complaining about is worth medical attention or not. Because there are those people who feel that there is something wrong with their body part or their genitalia, and they just want some alteration. And really, when you inspect properly, you find that they don't actually need it. So those are the people who have that condition, the psychological condition which we call dysmorphic, dysmorphism. Yes. Okay, where they feel there's something wrong, but there's really nothing wrong with them. So such are the ones we refer to psychiatrists for counseling, and once they're convinced that all is well, then they continue their lives.
Okay. You mentioned about labioplasty, where you do reduction. Yes. Are there instances where women want an increase in the size of their labia?
Yes, but that's a small minority, that those who want an increase. And that means trying to stretch the skin. For instance, if A woman, maybe for some reason, has had FGM, like we mentioned before. Then we try and mobilize the skin by stretching the skin to try and bring the covering over there, rather to reconstruct the labia minora just to cover the opening. We've seen instances where women have come, like for instance, I had a case of a woman who had visited a medical facility complaining of excessively long labia minora. And I think the practitioner, maybe due to reasons of poor training, overdid what he did. And the woman came with a completely exposed genitalia. So she wanted to find a way of how we can actually cover. Now that involves engaging a plastic surgeon to assist us in mobilizing the skin, to pull the skin, and then eventually at least get some cover to avoid issues that she was complaining about of discharge and discomfort and so forth. Yeah.
Okay. So what other procedures or reconstructions and repairs do you do for the women, for the women's external genitalia?
Okay, apart from that, for instance, as women age, those who are above 40 and above, they tend to lose fat in the labia majora, and therefore the labia majora becomes a little bit flat and flabby, and that tends to cause discomfort during coitus. So what we're able to do is to transfer some fat from any part of their body, especially the abdomen that usually has a bit of fat, and we actually transfer the fat from the abdomen and push it into the labia to give it that good feeling and swelling that they desire, and therefore they're able to feel that now things are really back to near normal as they were previously when they're a little bit younger.
Okay.
Then of course, the other minor procedures that we can also do that may be a bit controversial, for instance, like heminoplasty, but yeah.
Why is it controversial?
Well, it's controversial because this is something among the communities that really adore virginity, that before marriage, a woman should actually be a virgin. So those who may want to have a reconstruction and they request for it, it can be done, yes. But look at it on the flip side. This woman would pretend that she's never done anything before to the man that is interested in her. But, well, depending on really what one wants, that's why it's controversial. Because it's taken that it's not true that this lady was purely a virgin. She was previously messed up a little bit and then come back for the construction, and therefore she got back her life. Well,
so that makes me ask the question about, are we as a society open to discussing issues around sexuality of women?
we are not very open to discussing sexuality among women, because you find that even among some of us as parents, we find it very difficult to talk to the girl child about sex, that we actually pass that duty to either the teacher or the Sunday school teacher or the school teacher to try and talk to these girls about sexuality. We're sort of shy, you know, as a society. We're not able to come out in the open and talk about sexuality very openly with our children. And so that also appears among the adults, you know. Yeah.
From your field where you deal with cosmetic gynecology, both for cosmetic purposes, yes, and for reconstruction, does this discussion change, or are people open to discussing these issues that we're actually tackling now?
Yeah, when they come to consult on matters cosmetic, usually it's a one-on-one discussion, and therefore the woman tends to feel more free to actually express herself as to why she's come to consult. Maybe she feels that there's something not very right with her genitalia from childbirth or genetically, or maybe she's undergone the cut and now feels it's about time something is done to restore her sexuality as before. So in that situation, The discussion or the consultation on cosmetic gynecology usually is actually a session that on its own, you take a good history from the patient, find out why she's come to you, and whether really what she wants is really possible. Then you do a physical examination to confirm whether what she's complaining about is real or not. And therefore, thereafter then is when you actually discuss with her and try to explain to her everything that appertains to cosmetic gynecology. Because this involves even taking images so that you compare the images before and images after the surgery. Because sometimes when they have that dysmorphic disorder, they may come back to you and say, I don't think you did anything. I feel that this thing wasn't properly done, so can you repeat the job again? So using photography, you're able to show them that, yes, this is how it was before, and this is how it is now, so that you're able to convince them.
Compared to women or partners that come for cosmetic purposes versus those that come for reconstruction,
Yes.
Who are the majority?
Actually, you'll find that the majority are those who come for cosmetic purposes. The ones who come for after FGM are not so many, because you find that those who have undergone the cut culturally, some of them feel that, okay, that was done because culturally they are accepted when they have undergone the cut, and when they have not undergone the cut, then they are ostracized by the community. But I think that is changing, as you heard from the previous gentleman who you talked to here, that now slowly that is changing, and that rites of passage are now changing from the FGM to more humane and more modern ways of rites of passage for the teenagers into adulthood.
Mm-hmm.
Yes.
And are men supporting women who are seeking either surgery for cosmetic purposes or reconstruction? Do you see the men or the partners of these women supporting them through this?
The interesting thing is that majority of the women who come for reconstructive surgery do come alone. And when you ask them about their partner, they'll tell you that they feel that there's something which is not right and that needs to be remedied. But as per the rules that we have in cosmetic gynecology, it's very important to involve the partner, because after the procedure has been done, this lady will have to stay away from the man, or actually abstain from sex for a duration of time up to about 6 weeks or so. And during that time, if the man is not informed, then issues can arise. He may demand his rights when this woman is still healing, and then in the process, the procedure will actually be messed up. So we encourage men to actually accompany their ladies when coming for consultation, so that they also understand what procedure their women are going to go through, and that they are going to be requested to abstain from sex for a duration of time. Because without that understanding, then that will bring disharmony in the family.
Okay.
Yes.
Your final comments on this issue about FGM and undergoing repair after the cut?
Yes. Now, FGM, personally, FGM, as is widely known right now, has a lot of problems, and a lot of problems in obstetrics. Because, like we said before, FGM has immediate side effects, which include bleeding, infection, and sometimes even death. And of course, long-term side effects, which include obstetric problems, like, for instance, when there's scarring of the genitalia, childbirth will become difficult, and that may lead to trauma, and also occasionally even loss of the child during childbirth. So I still feel that FGM is not right. And that now that with the advent of cosmetic gynecology, the women who have undergone FGM, the less severe types, we are able to assist them to restore their dignity.
Thank you very much, Daktari, for taking your time this evening to talk to us about what you do, and that's reconstruction and cosmesis for women. That's all we had for you this evening. We had Dr. Francis Were, who's a cosmetic gynecologist, and earlier on we had Charles Leshore, who is an intercultural nurse with AMREF. We'll continue this discussion offline. You can reach me at Dr. Mercy Korir or at KTN News for further discussion and further engagement on this topic about repair after the cut. Until next Saturday when we discuss another issue that pertains to your health, I wish you a very good night and a blessed Sunday ahead. Enjoy the rest of your viewing.